All right, everyone. So what I want to look at is, we're going to talk today about blocks to nursing student successful outcomes. And I just wanted to share the fact that what I wanted us to look at today and hopefully to achieve is to be able to identify blocks to undergraduate nursing students achieving academic success. The learner will identify strategies to minimize blocks that impede academic success. So this study was really driven by the social cognitive theory. And I'm going to minimize my, sorry. I'm going to do it this way so that I can talk about the social cognitive theory. But the social cognitive theory really is, was created by Alfred Bandura in 1986. And the goal was to explain how people regulate their behavior through control and reinforcement to achieve goal-directed behavior that can be maintained over time. And, a lot of people use the social cognitive theory in terms of learning. And so he has some factors listed or in his theory. Environment includes social, so we have cognitive factors, behavior, and environmental factors. But environmental factors include social and physical environments. Like an example, the people that the learner works with, family and friends, as well as, the physical environment, such as a room, the temperature, and so on. And personal factors include mental cognition, personality, self-efficacy, curiosity, and really the motivation to learn. Behavior is affected by the situation. The cognitive or mental representations of the environment and the constant influence of the three components on each other. Now, I just wanted to focus a little bit on self-efficacy, which refers to the level of a person's confidence in their ability to successfully perform a behavior. And self-efficacy is influenced by a person's specific capabilities and other individual factors, as well as environmental factors such as barriers and facilitators. And so with this study, what I wanted to do was to oh, I have to move this up here. Okay. Was just to talk about the fact that I looked at some of these questions. What are the identified barriers to achieving academic success? Do internal and external blocks reduce academic success? And does academic self-efficacy increase academic success? And do internal and external blocks reduce academic self-efficacy? And does academic self-efficacy mediate the relationship between internal and external blocks and academic success? Now, I looked at this, looking at the literature and noting that much of the literature that focused on academic success really looked at academic factors that impede academic success and not so much those non-academic factors. And so that's the reason why I use these instruments. And so I used, in terms of collecting the data, a demographic questionnaire, internal block scale and external block scale that was created by Dr. Arathusiak, and I, received her permission to use these scales. And internal blocks were those things that were personal, internal things, um, the capacity of the person, if they're, how they're feeling physically, those types of things. External blocks were those things that were outside of that person's control. Such as, do they have enough money to help them to pay for their courses and so on. And then I looked also at a self-efficacy scale, and one that was really tied to academia, which was the college academic self-efficacy scale. And I did a descriptive correlational analysis. So looking at the study sample, I had 103 nursing students. And just to let you know that before I could get IRB approval, they wanted to make sure that I wasn't the person collecting the data, because they didn't want the students to feel intimidated to do the study because I taught them or anything like that. So these were nursing students enrolled in their first clinical course in a traditional Bachelor of Science program, and were able to read and understand English. And the reason I did these students in the first clinical course was that a lot of people, when they looked at academic success, they look at academic success in terms of passing the NCLEX. And so most people looked at seniors in colleges. And I wanted to figure out, was there a way that we could help students before they got to being seniors in school? And so the sample characteristics in terms of ethnicity, you can see here, we had a multiplicity, Caucasian being most, half of the population. And most, of course, were female. And then we had the sample characteristics in terms of age. And as you can see, less than 10% of the sample were between age 41 and 50, not anyone over 50 years of age. So we had a high percentage under 21, those who were just coming from high school. So the college academic self-efficacy scale, when I looked at all the instruments, the internal blocks and external block scales, and they all had good alpha coefficients for this study. And when I looked at the scales again, looking at the means, after collecting the data, you can see that students felt, if the score range was up to 165 and the mean was 125, most students felt that they had that self-efficacy to be successful. The internal block scale had a upper score of 80, and the mean was 39.8, which is not really good. It's saying that they had quite a few blocks to achieving successful outcomes. The external block scale was a little bit, I would say, were satisfied, and there were no relationships with academic success. However, correlational analysis indicated that external blocks was significantly related to internal blocks and self-efficacy. And so I conducted further analysis to see if internal blocks mediated the relationship between external blocks and self-efficacy. And so I looked at a series of regressions. So the first model looked at the fact that external blocks predicted looked at external blocks that predicted external blocks. And the third model indicated that controlling for effects of the mediator, which was the internal blocks, on self-efficacy, the effects of external blocks was no longer significant. So when I did that, if you look here, external blocks and self-efficacy, the significance was 0.218 at 0.03. And when I entered internal blocks into the, when I took out internal blocks out of the equation, if you notice, external blocks no longer had a significant effect on self-efficacy. But internal blocks still continued to have an effect on self-efficacy. So it indicated that really it was internal blocks that was driving that relationship between external blocks and self-efficacy. So I looked at some of the, going back to looking at the internal blocks, looking at the self-doubt, the multiple role strain, the emotions, the fatigue, the self-induced stress, and trying to help students to figure out how to work on that. And even looking at external blocks, those issues that correlated with self-efficacy, or the blocks that they said affected them, looking at those as well. So what, I was in a group that, and I was a chairperson for a group that was looking at successful student outcomes. And so when I did the study, what I said was, in terms of teaching the students, what we could do is let them know that there are some behaviors that they need to engage in order to achieve success. Just coming to class, listening, and sometimes they don't listen. If students have their computers, if you walk around, you'll notice that they're shopping, that they're doing their Facebook, they're doing all kinds of other things other than listening and paying attention. When you come close to them, they quickly click and bring up their PowerPoint as if they were listening. So just posting some list of behaviors that they should engage in class to help them to succeed. Note taking, asking questions if they don't understand. And then, just indicating to them that they, in order to achieve success, what we did was create a mandatory 3-hour prep session. And that was called Achieving Success in Your Nursing Courses. And this was given to the students before they enter their first clinical course. And most colleges look at the first clinical course as health assessment. And so it was mandatory for them to register for this, to attend this course. It wasn't a course that they got credits for, so they didn't have to pay for it. It was a free course, but they had to attend. And what we looked at in this was time management, study habits, note-taking skills, talking about resources that were there for them, like the Math and Writing Center, library use and navigation of online library, NCLEX are in review, you know, texts. So we would show and talk about critical thinking as well. And critical thinking in terms of taking care of patients, which we would translate into questions that they would get, objective questions that they would get in courses, because your objective questions really are presenting a scenario to the students of what could happen in the clinical setting. So we did that. And last but not least, the importance of proper nutrition, rest, and exercise. Because if you notice, sometimes students come into your class with chips and, you know, Coca-Cola, and they tell you that they didn't rest because they were up all night cramming. Exercise, which I said to them, releases endorphins, helps you to feel happy, you know, to feel as if internally you can do, you can achieve. They could not engage in because they thought they did not have any time. We also implemented the HESI A2 exam to identify students with challenges and provide advisement for them. And look at students in courses from that point in time to see who might not be doing well, and, you know, ensure that they got an advisement to achieve success. And also, so that would be looking at students who were getting grades of C+ and below in their courses. And finding out what was the issue, maybe recommending them to the math and writing centers, because we realized that students, it was difficult for them to do math, and their writing needed some help. For those who work, we recommended that they did only a maximum of 8 hours per week. Note I said recommended because you can't mandate, because you don't know what they're doing if they're not in school. Reminding students to apply for financial aid and available scholarships if they're having financial challenges, and also referring students to the counseling center if they're having mental challenges, including anxiety and depression. Because, you know, sometimes when students are not achieving their academic goals, we've had cases where students have committed suicide at various colleges. And also to do a supplementary review course during the senior year, utilizing the faculty in the department and not just an outside review course. And doing all of these things, we realized that the NCLEX scores started to improve, because we were having trouble with NCLEX scores. And that's why we had this academic success group. And once the NCLEX scores started going up, the group was disbanded, but the course, the mandatory 3-hour prep course, is still in place to this day. Even though I'm not at the college, I know that this course is still in place because it seemed to help students to achieve success. And most of the things here that I talk about have helped the students. So just the important references, and just wanted to thank you for listening to my presentation.